We welcome you back to our program today, and a rather special segment, and a frequent guest on our program joins us today, Dr. Thomas Hirose, and we welcome you back to the program today under the auspices of the Saddleback Hospital and the Memorial Medical Center over there and the foundation as well. We know from our previous visits with you that your main area of expertise in the medical field is blood, blood testing, and also blood drawing. And we've talked about that in past segments, but today we're going to talk about the new blood donor center over there at the hospital. Talk a bit about that.
Yes, good morning.
Good morning.
Thank you for having me here. This is such an exciting program. Blood transfusions, I think, rank in the top 5 the 20th century discoveries, allowing people to survive that normally would not survive, and allow people to have surgery that normally could not have surgery. And the blood supply being so important, one of the messages that I'd like to send out is that all the blood that we use is only obtained through volunteer donation. Mm-hmm. And this is because of safety measures and because we found that this was a mode to provide the best and safe product. Right. The country uses 11 million products a year for red cells and roughly 30 million total with blood and blood products. Mm-hmm. And so at the hospital, we're excited that we're being proactive in allowing donation at the hospital itself for, especially from the friends, family, and relatives of all the patients that are there.
So it's possible if you have a family member or a friend who's going in for surgery or has been in an accident or whatever reason might need blood, can you specify?
You can. And this is 2 ways to do that. There's a blood replenishment program. I so encourage everyone to come in and do that. Only 5% of the population donate blood, and the rest of the 95% is such an opportunity to lend a life-supporting therapy to your friends, family, or relatives.
You talked about the fact it's voluntary, and I know we've all seen the movie and television show plots where somebody's totally down and out, and they'll go to some, shall we say, maybe questionable facility in a downtown kind of a seedy area and quote-unquote sell their blood. First of all, I guess we don't really allow much of that anymore to actually get into the population, at least into our hospitals, correct?
That's right. And we discovered in the 70s and 80s that to make the blood safe, we needed to do 3 things. One is to stop paid donation. The second was to ask very important questions on risk behavior. And the third is to put so much energy and research into better and better testing. Mm-hmm.
And I know one of the things that is involved is, in fact, a rather elaborate questionnaire,
yes,
followed by a verbal interview, usually with an RN, who also checks blood pressure and does a little finger stick to check for what? What's that little finger stick for?
We make sure that the donor has enough blood in their body to donate. Mm-hmm. So there's an element of protecting the donor and there's an element of protecting the recipient. Right.
And then I understand after that little plastic bag gets filled up and they unhook us and stick the Band-Aid on our arm and give us our cracker and our juice and send us on our way. That blood doesn't necessarily doesn't automatically go into somebody's arm. It's tested again, right?
Yes, it does. It goes through more than 11 very sophisticated molecular tests to look for dangerous viruses such as HIV and hepatitis viruses. We do a battery of tests very quickly, and the turnaround is within 48 hours. Mm-hmm.
Some people might wonder about the procedure, and obviously if you're laying on the table, you really can't see what's going on. But I understand that down below, there's actually some motion taking place?
Yes, and it's because the body knows that it shouldn't be free-flowing outside of the body, so it has things to clot. So we put an anticoagulant in the bag, and as the blood is going into the bag, it's rocked and kept from clotting.
Mm-hmm, mm-hmm. The average person, I guess, could donate more than once a year, several times a year. There are some age and some health restrictions, though.
Yes. A typical healthy donor can donate every 56 days. We need them to be at least 110 pounds, although they could donate for themselves at a lower weight. Mm-hmm. And they need to be at least 17 years or older. Mm-hmm. Yes.
And is there an upper age limit?
There is not.
Huh.
And we're finding that a donor can be healthy and donate blood at a very advanced age. And it's a combination of supplying blood for yourself, but also sending the message to everyone that you know. It's so important to come in. We have these disasters during the seasons, holidays, and during the summer where at sometimes we may not have enough blood around.
You might have to borrow from another hospital or come up with some other way to supply the need there if it exists.
On rare occasions, the blood supply can be so low that we have to close the emergency room. Mm-hmm. So we're trying to avoid that by bringing in people.
You mentioned donating for yourself. would this be what, if you were having non-emergency surgery and you knew they were going to have to do a blood transfusion, you would go in, what, a few weeks in advance?
That's right. The blood that's collected can be stored for 42 days, and surgeries that are very predictable in their amount of blood loss is a good thing to donate for yourself.
Right.
What comes to mind is hip replacements and knee replacements and open heart surgery.
So unless it's an emergency operation, that might be something the person would think about, donating their own blood, and they'd get their own blood back then that way.
That's right.
Right. What about certain medications? Anybody over 50, I think, is on one or more medications these days, it seems like. Some people several. Would there be any counterindications there on what you're taking as far as personal medications?
That's a very good question. By and large, all the medications taken are safe for a recipient. We look at the medication list because we want to know, is it safe for the donor to donate based on heart medications or insulin? So in general, if you're on insulin, it means that your nerves or your vision or your capacity to lose blood may be too unbalanced. So we recommend not donating blood for someone else if you're on insulin, as an example.
But if, again, someone knows they're going to be having surgery, they could specify and say, well, this is for me.
That's correct.
Right.
And we do then collect blood for those patients.
A lot of people I know have seen the shows like MASH, where it's a military situation, emergency hospital, and they'll literally do patient-to-patient transfusion. That's pretty risky, and we don't do that anymore either, I guess.
We do not. That's very rare. There is a few patients whose blood type is so rare that their only donor is their relatives. And in my career, I've only seen that happen once, where we didn't do it arm to arm, but we used the blood very quickly and didn't have all the testing back because we knew that was the only blood available.
We've been talking primarily about whole blood, but we understand also that there's certain things can be done with the blood and centrifuged and different things taken out from a certain person who might just need a certain part of blood, or as you call them, a blood product, I guess.
And when blood comes out of the arm, we call it whole blood, and it's composed of plasma, which is the clear stuff, it's the red cells, and then in between is platelets, which help for coagulation. So every donation, potentially, you can make a gift of 3 different types of life-saving products.
The center is new over there, the hours of operation?
It's Monday, Wednesday, Friday, business hours, and we're hoping to expand it to every day, and we're looking at evening hours soon and weekends hopefully in the near future.
And whereabouts in the hospital facility would we find it?
It's right near the main entrance to the left side, and there's actually parking for donors in the front of the hospital.
All right. If you want to consider doing that, check it out Monday, Wednesday, Friday over there during business hours at the hospital, and they'll take good care of your blood and use it to help somebody else and possibly even save a life over there at Saddleback Hospital. Dr. Hirose, always a pleasure. Thank you for joining us on the program today.
Thank you.
We'll be coming back with more as our program for this Tuesday continues. Stay with us. All right, so.
The civic-minded citizens and physicians who planned Saddleback Hospital envisioned a full-service, high-tech hospital.
The medical center is a state-of-the-art facility that continually upgrades to remain state-of-the-art.
Our success is a highly skilled, diverse, and caring staff who meets all of your healthcare needs.
We represent virtually all medical specialties, and we practice in close proximity to you, our patients.
Saddleback Memorial Medical Center, keeping the village healthy since 1974.